Hi, hello, my name is Paul Spreadbridge. I'm a qualified therapist registered with BA MBA CP, and I'm also an EMDR therapist as well. And the purpose of this talk is just to explain what that really means. EMDR is eye movement desensitization and reprocessing, which sounds really quite involved. And basically, what it really means is that when you are asleep, you have REM sleep, and your eyes will move from side to side, and that's in the deep part of sleep. And during that time, your mind will be reprocessing the events of the day. Now that's all well and good for everyday events as they go, but often we have traumas in life, and quite recently I've been seeing military veterans and serving soldiers, members of the armed forces for example, who have suffered from combat PTSD. Also others that may have been involved in traffic accidents, assaults, quite bad aggressive domestic violence situations, sexual assaults and so on. And in those cases there will quite often be quite serious trauma. And those traumas are rarely reprocessed by the mind in the right way. In other words, the person is often affected by the trauma for, in some cases, years to come. One of the treatments for this is CBT, but a more controversial but quite recent treatment has been EMDR, introduced really in the early 80s by Francine Shapiro, who sadly died in the early part of this year. But Francine Shapiro introduced EMDR through observation of the mental processes of reprocessing and how we actually adapt to sleep patterns. And she found that through the movement, external movement, bilateral stimulation, which is where the therapist will quite often use his or her hand in a backwards and forward motion, replicating the REM sleep, as that has proved to be hugely effective. Personally, I have done that with the hands, but also today and increasingly I will use either lights which go from side to side, or bilateral stimulation using perhaps some buzzers in the hands. There are other ways of doing this, also with music, but the most important thing to remember is that with EMDR, it is lasting. In other words, the effects of the reprocessing through bilateral stimulation with the help of the trained therapist actually gives a permanent outcome. Sometimes it will take 1 or 2 sessions, sometimes it will take perhaps 10, 15, 20 sessions, and basically there's a protocol to follow of 8 sessions which leads up to, or protocols which lead up to the installation of what is known as a negative cognition. In other words, a simple example might be I am scared or I'm out of control, and through installing this EMDR, the mind is actually helped to move forward to a safer place. And so the outcome of that would be, I'm now safe, I'm in control, I'm no longer scared, and so on. And that is then installed, and the patient or the client is then put in a safe place through grounding and relaxing, and then in the next session there is a revision made. And it's often said that by the patient that the reprocessing is carried on through that time in between appointments. Quite often, I've found over the last year, it may be a small number of EMDR sessions, usually an hour and a half long, then results in the permanent cure. The patient will always remember the event, but it's how they feel about it that changes. So in conclusion, that is EMDR, eye movement desensitization reprocessing, specialist therapy, but one which has been very helpful to many millions of people around the world. And there's also been an enormous number of random controlled trials, RCTs, which have been approved by also the NHS as a prime or the first line of treatment for trauma through the National Institute of Clinical Excellence. And so there we are, and if you're interested in learning more about this or perhaps coming forward for therapy, please do contact Horizon Counselling. Thank you very much.